Good afternoon, everybody. I hope everybody's having a great day today. This is Tammy Epps, and I am the Director of Media Relations and Social Media here at Prisma Health. And I am happy to be with you again today because when I usually come, I usually have a rock star team of Prisma Health experts with me to help give you some important information about what's going on in our community. And today's good information is about RSV, flu, and COVID, respiratory illnesses. So we're seeing that across our Prisma Health footprint, and we're seeing it in record numbers. And because of that, our team is going to talk through some of that with you, how it's impacting our healthcare system, what you can do to help us help you. So our team today includes Dr. LaCroix, who's a pediatric infectious disease specialist and the medical director of Prisma Health Children's Hospital in Upstate. And we have Dr. Kathryn Burch. Dr. Burch is a pediatric infectious disease specialist at Prisma Health Children's Hospital in the Midlands. And we have Dr. Joshua Gray. He's an emergency medicine physician and the associate medical director of the Prisma Health Greenville Memorial Hospital Emergency Trauma Center. So that's our team. And with that, I'm going to go to Dr. LaCroix.
Thanks, Tammy. I think I'm unmuted now. Thank you all for joining us and for bringing this important message out to the community. It certainly has been very well publicized in multiple news medias about the upsurge of both respiratory syncytial virus, which is RSV, and influenza in the pediatric communities. And it has really stressed the pediatric care system. And I just wanted to share some of the things at Prisma Health that we were doing to directly address this and also to assure our communities that we were ready and prepared to take care of your children. One of the most common questions that I've received over the past week and a half has been around what are the rates and what is happening. And certainly for RSV, this is typically the time of year that we begin to see a little RSV beginning. But what has happened is in the Upstate, RSV rates are about 8.7%. And for comparison, at the end of September, those rates were at about 4%. So we've more than doubled the number of cases that we are seeing for children with RSV. And RSV affects most often the very youngest children, children less than 2, but older children who have special health conditions are also being affected by this. So certainly the rate of rise has been fairly rapid for RSV and has led to more of those young ones needing to be hospitalized, and certainly for a number of children needing to seek medical care. What has happened as well is that influenza has arrived early this year, and particularly in the pediatric population, we're up to about 16% influenza positivity rates on the children that we're testing. And when we reach out to our colleagues, which are school nurses in the health centers, and certainly within our pediatric community around the Upstate, a huge number of children presenting with complaints that are either testing positive for influenza or they're talking to the families and they have symptoms compatible. So what we've been doing within our network of hospitals is leveraging the multiple areas that we have to take care of children. And so that's really been around. In the Upstate, we have Greenville Memorial, which is the tertiary children's hospital. We have 2 children's hospital satellites in the Upstate, one at Greer and one in Oconee, which is also staffed by pediatricians and specially trained nurses, respiratory therapists, child life specialists who can help us support these children. So we're able to have children into a pediatric friendly environment to help take care of them when they require hospitalization. We're working very closely with our Midlands partner. Our other tertiary care hospital is the Children's Hospital in the Midlands, and they too have pediatric intensive care and all of the higher level care opportunities that we might need to have for children, and we're working collaboratively with them. They also have a children's hospital satellite in Sumter to help serve the children of the Midlands with, again, pediatric trained care. Our ability to coordinate between these sites, and certainly our constant interaction and communication about resources and bed capacity, has helped us manage this. We also have been working really closely with our emergency physicians and our emergency care sites to determine what do we need to do next? How can we continue to care for children that need to come in for a larger evaluation? And at Greenville Memorial, we are in process of setting up an alternative care site. So this is an area where children who are of lower acuity, meaning they're less severely affected by an illness, that they can be evaluated in this area in our children's hospital lobby, receive the treatment evaluation that they need, and then be able to go home with their families. And this is going to hopefully expand our ability to get more people in. Our primary care practices have opened up additional sick visits, which means those visits that are designed for folks who need same day or very next day evaluation. Those have all been opened up to provide more access. For many of the children, the respiratory viruses don't require hospitalization, but they do often need further evaluation. And so that's where having primary care options, having our urgent care centers available so that we can be able to provide evaluation, treatment, and care for those children in a timely fashion is what we've been working on. Virtual visits continue to be very popular, and certainly our primary care colleagues are doing virtual care, and they also are offering adult options for virtual care. And so you can certainly look at the prismahealth.org same-day care site to determine what's going to be the best way to get your children or even yourself as the adult evaluated, because we know these viruses don't always stay just with our little ones, that often, particularly influenza, is very easy for households to transmit within them. So Tammy, I'll be happy to share any other information, or I know that that we have others that have great information about what we're doing as well.
Good. And with that, I'll go to Dr. Burch. Thank you, Dr. LaCroix.
Okay.
So again, my name is Dr. Burch. I'm a pediatric infectious disease physician here at the Children's Hospital in the Midlands for Prisma Health. And I just want to start by saying, number one, thank you, Dr. LaCroix, for all of that great information. The Midlands is mirroring basically what's going on in the Upstate. We definitely, for the last several weeks, have seen an increase in RSV. That's been the number one respiratory virus that we are seeing mainly in outpatient settings and inpatient settings. But starting this week, I feel like we're starting to see the RSV decreasing some and influenza A taking its place. And so that is definitely, again, things that we're seeing in the outpatient setting, but also in the hospital as well. And so what kind of symptoms do you need to look at for your children to get them to the doctor and or, maybe take them to the emergency room? The most important things is just to make sure that your child is breathing okay. So when we're talking about RSV, usually in infants and small age children are the group of people who really get affected with RSV. Only a small percent traditionally get admitted to the hospital. That's usually around 3% of all RSV cases. That being said, those individuals who are having more difficult breathing, being, having nasal flaring or having, what we call what we call respiratory retractions. Thank you. That, definitely that's something very worrisome, but also if they're coughing, if there's any apnea episodes. And so that's what is apnea? That's sometimes where your infant or your young one holds their breath or doesn't breathe anymore briefly. Those things are very worrisome, and you should get your child to be seen by the doctor right away, or even go to the emergency room for that. Other things to be looking for in children with respiratory viruses is to make sure that they're drinking okay, that they're making good wet diapers, that we're keeping up with their intake, all of those things. When it comes to influenza, again, this is a respiratory virus that not only affects the infants, but also can affect older children as well, all the way up to adults. And for those individuals, it's basically just making sure that they are breathing okay again, that they don't require oxygen, and that they're taking good oral intake. So they're making enough wet diapers, or they're drinking enough to keep themselves hydrated. Some of these respiratory viruses, we are definitely seeing what we call secondary bacterial pneumonias associated with them. And a lot of those is who we're seeing in the hospital. That means that they have the respiratory viral infection, whether it be RSV or influenza. They kind of get over that infection, and then they might have a new fever or a new cough, maybe a day or two later, and that's a bacterial pneumonia that the person can get. And so be looking out for that as well, parents. That's something that you definitely want to make sure that your doctor is well aware of, and maybe have to get your child seen. The most important way that we can protect ourselves from RSV and influenza is to make sure, number one, that we're washing our hands, that we're following great cough etiquette, meaning that hopefully if you're ill, you're wearing a mask, but if not, just to make sure that you're sneezing or coughing in your sleeve and not in your hands. And then for influenza, the best single way to protect yourself is to get your flu shot. And y'all, this is the time right now to be getting your flu shot if you haven't already gotten your flu shot, or your family hasn't already gotten your flu shot. Your body needs about 2 weeks or so to make those antibodies to help protect it from influenza. And so because we have so much influenza going around right now, you definitely need to go get that vaccine. That being said, the vaccine might not protect you 100% from getting influenza, but what it does do is it helps you from not getting admitted to the hospital, and it can absolutely help you from not dying from influenza. So that is very important. Making sure, for parents out there, if your child is ill, please don't dope them up with ibuprofen or Tylenol and send them to school. Keep them home if they're ill, because not only does that get them better quicker, but it also keeps from us spreading those respiratory viruses in school. And then also, if you're ill and have to get outside the house, please wear a mask, because not only are you, protecting others, but it'll also make you feel like you are doing something if you have to get out. Halloween is coming up on Monday. So what are some important things that you could do there? If you feel like you need to wear a mask, I think that's very appropriate. But the other things that you can do, because it's outside, is then stay in small groups to go trick-or-treating in. Definitely, have a good time. We want you to enjoy Halloween, but just be safe when you do it, and have a good time. So I am finished, and I will pass it on to Dr. Gray.
Dr. Gray, I'm coming to you.
Thanks,
Dr. Gray.
Yeah. So, the big thing that we see in the emergency department is lots of questions from the public and neighbors and friends about when to come to the emergency department. And I think a lot of people struggle with that. And the available opportunities of other care areas to go to, whether it be primary care offices or urgent care. I think a lot of people have become quite savvy with doing COVID testing at home. And so those are all other opportunities. And so most patients, both in the adult and pediatric patient populations, don't require ED level care. And so we're here for you if you need us. But I think if you need to be tested or to see if you might have a pneumonia or aren't that sick, but need to be seen by a physician, that primary care, and I think as Dr. LaCroix mentioned earlier, the ability to get virtual care through our platform, especially if you have MyChart, those are all very helpful. We've not only seen a surge in pediatric patients in the emergency department, but also in the adult. We've definitely seen more people in the last 2 to 3 days, really, in the adult patient population, as we've kind of progressed through this last week or so. The good thing is that we've been able to stand up lots of different care areas throughout the health system. As Dr. LaCroix mentioned, we've been able to leverage our size and different care areas and stand up these different places that we can see patients to manage this surge of patients. I'll reiterate Dr. Burch's point that vaccination is the best thing that you can do, and the earlier the better this time of year. Obviously, we're already starting to see lots of patients, and we do need that about 2 weeks for you to build up a good immune system. The other things are that there are antiviral medications for flu, so whether that be Tamiflu or other medications like Xofluza, that the vast majority of patients won't require. And so those medications are usually reserved for patients that are at the extremes of age, so less than 2 or over 65. Also patients that are generally immunocompromised, so those patients that are receiving cancer care, pregnant patients, or anybody else on immunocompromised or immunotherapy. And so those are the patients in general that would benefit from those medications, and those are things to talk to your primary care physician about if you would benefit from those types of medications. In general, if you do need those medications, receiving care within the first 48 hours has been the most effective use of those medications. And so if you feel like you do have the flu and you do fall into those categories of patients, I would recommend seeking care with your primary care earlier rather than later. I think that's pretty much it for me.
Dr. Gray, I'll just add this question. I know that when we have our community members come to the ED for things like flu or those non-emergent things, that just really is, it causes a long wait for a lot of people. Can you speak to that for me?
Sure, yeah. So we have a triaging system in the emergency department. So our goal is to always get you the fastest care as possible for the sickest patients. And so those patients that aren't awake or need breathing assistance, so whether that be nebulizers or ventilators, we're going to prioritize those patients. And so the more patients that show up that don't need those services that the emergency department has the ability to provide, makes it more difficult to get to the patients that need care. And so oftentimes if lots of people show up and we're very busy already and they don't need those level of services, then they may need to wait or have to wait. And so I think as many people have probably witnessed in the last few weeks, that all the emergency departments have been exceptionally busy. And so if you have a minor illness, it's going to be a little while till we get to you. Don't worry, we will get to you. But we're going to be caring for those that are the sickest first.
Right, thank you. I'm going to go back to Dr. LaCroix. Dr. LaCroix, the question is about whether we have seen any deaths from children with RSV.
So in the Upstate, we have fortunately not seen deaths from children from RSV. We've had a number of children that have required ventilators, but fortunately being able to provide early and state-of-the-art intensive care, those children, in fact, this morning, those children that we have been monitoring have been able to come off their ventilators. So very encouraging that as we support these children, For RSV, we don't have good antivirals. We don't have a vaccine, and that's where parents protecting their youngest children with keeping them away from large crowds, really good hand washing. If someone is going to be around, if they have any sort of symptoms, having the mask around those babies, just to try to give them another ounce of protection, because we are left with what we call supportive care, which is me helping them breathe, supporting them with nutrition and fluids through their veins, and letting their little immune systems fight this virus off.
Yeah. I'm going to go Dr. Burch. Dr. Burch, have you heard of any deaths in the Midlands?
We have not had any deaths to my knowledge in the Midlands. And actually that is something that's a pretty normal thing. Usually RSV, we don't see a lot of deaths with. We do see, some hospitalizations like Dr. LaCroix said, and we need to support those children, but most of the time they do pretty well with the state of the art, ICUs and medicine that we have to offer them.
Hey, so this is a question. Do adults get RSV?
They absolutely can get RSV. And most of the time though, adults who get RSV are going to have a cold. And usually it's not lower respiratory, it's more upper respiratory. But those individuals who are immunocompromised or elderly can have a worse outcome with RSV as far as potentially getting pneumonias with it or having to be hospitalized, needing that respiratory support to get over the illness.
Then I'm going to go back to Dr. Gray. Dr. Gray, the question is related to flu and COVID. Basically, the question is, are we seeing that flu and COVID infections impacting hospitals? And do you expect that the flu hospitalizations would eclipse COVID hospitalizations anytime soon?
Yeah, so historically, the rates of flu requiring hospitalizations is lower than the peak surges of what we saw with COVID. Most patients will weather the storm of flu well, even the young and the older patients. And the main patients that we see difficulties are those that I kind of mentioned before that are immunocompromised or have intrinsic lung disease like COPD or asthma. And so I would anticipate that the same levels of admissions or less than compared to our prior COVID hospitalizations. But after these surges and peaks, this is kind of a new experience. And so we'll keep a close eye on rates of hospitalization and continue to upstaff as we need to.
Good. I'm going to go to Dr. LaCroix. I was going to say, we do have a chart of all of the numbers for our Prisma Health hospitals, like in the Midlands and the Upstate, that I can send you, that kind of shows the way the trends have been going. And that is interesting because it goes back from August to current. So the question, Dr. LaCroix, is that we stated that the RSV has approved this month and the flu cases are ticking up. Does that show that RSV is easing back to more its normal level?
So RSV can have what we call a biphasic peak, meaning that we can have an early season as we saw this year, and then we have a second wave of infections that come in the early spring, late winter period of time. So it's not unusual for us to see a biphasic season. I think that we certainly, during the period of COVID with people not being around each other and extensive masking, we saw very, very little flu in the past couple seasons. And so the upsurge of flu clearly is back closer to its usual epidemiologic pattern. It's just a little earlier for us than we typically we begin to see these higher flu cases begin up in the December to January timeframe. So earlier than in the past.
I'll go to Dr. Burch. Dr. Burch, so the question is, what percentage of kids with RSV are typically hospitalized?
So traditionally, that's around 3% that are hospitalized with RSV. And so it'll be interesting to see what happens right now in this year. Obviously, we're not going to know those numbers right now, just with the secondary bacterial pneumonias that we're seeing. But typically that's 3%.
And do the children with severe illness from RSV, do most of them have pre-existing conditions?
Yeah, that's a great question. So you kind of have two different areas. So number one is those infants. So for premature infants, typically less than a year of age. For infants that were born on time, it's usually less than 6 months of age. Those are the ones that are at increased risk for potentially being hospitalized and having what we call increased morbidity and mortality from RSV. However, in older children, it's the individuals who have underlying illnesses or medically fragile children. They might have CP or a seizure disorder or some other issue that makes them medically fragile, that gives them an increased risk for potentially being hospitalized with RSV.
All right, I'm going to go back to Dr. LaCroix. All right, Dr. LaCroix, so the question is there any explanation? I think you talked about this the other day. Is there any explanation for the uptick in respiratory infections that we're seeing in pediatrics, not only in our state, but I guess in the nation?
We had 2 very unusual years as COVID came into play and the pandemic really spread, and a lot of environmental factors changed as far as people being together and masking, which altered, masks are very effective for both RSV and influenza prevention because they're droplet spread viruses, meaning that they're in the small droplets that come out of your nose and mouth when you sneeze, cough, laugh. And so distancing and masking altered the circulation of these other viruses. We typically see patterns of every 3 to 5 years. We have a very, very intense RSV season. And we had essentially no RSV season in 2020. And then in 2021, we had a summer season. And this is closer to the classic circulation of the virus, but in other parts of the country, like Florida, RSV circulates year round. So I think that the unknown factor is whether we will resume a true seasonal pattern or whether we will become more like other temperate climates where RSV circulates year round.
There's a question related to what percentage of pediatric ICU beds are filled. Do we know that number, and then of those PICUs, how much of it would be respiratory virus patients?
Yeah, so the ICU capacity has been very tight, meaning that we have within Prisma Health, we have a pediatric ICU in Columbia and we have a pediatric ICU in Greenville. And those beds remain full or almost full much of the time. What we have been able to do is to open what we call surge beds, meaning that we are able to expand our capacity and take care of critically ill children over that period of time. There are a number of other viruses circulating, and so our ICUs are filled with children that are injured, children that are experiencing other respiratory viruses besides RSV or influenza, which also are compromising their ability to maintain their oxygen levels. And then we layer that on top of children that are having the need for significant surgeries, children that perhaps are going through intensive chemotherapy treatments. So our ICU beds fill from a number of different conditions. And when you layer additional infectious complications and illness on top of that, that's when we begin to have to utilize our surge capacity. But we're just very fortunate in that we've been able to coordinate those efforts and work together and leverage our size to be able to care for these children.
All right, so the question is related to how what we're seeing in both the Midlands and Upstate, our rates And I know we're part of the Children's Hospital Collaborative. Do we know how we compare to the other like areas of the state? I'm not sure whether you know or Dr. Burch actually knows that.
Yeah, I do know we have been in close contact, and in fact, pretty much daily with our colleagues at MUSC, and they too are experiencing initially the RSV and now seeing the rise in influenza cases on top of that, and capacity for both Children's Hospital admission beds and Children's Hospital ICU care is under a lot of pressure.
There's a question about whether there's an actual like number. I do have a percentage chart that I can send to anybody who wants it that gives you sort of a COVID, RSV, flu picture, like I said, and I'm happy to send that to anybody. I didn't know, Dr. LaCroix, whether you knew what kind of numbers we're talking about. Are we talking about like 10 kids, 15 kids in the Children's Hospital related to respiratory illnesses?
Oh, right. Yeah, no. If you counted all of our respiratory illnesses, let me do some quick mental math. About 16 children hospitalized with respiratory illness out of a total number of about 57 beds. So there's some units within children's hospitals in which, like oncology units, where we try to shield those units from any type of respiratory illness admission. So for children's hospital acute care, medical surgical beds, pretty large numbers of children. That's been a pretty common occurrence all through the summer, because remember, the viruses rhinoenterovirus have circulated very heavily in the community. And when you get the pie chart, you'll see the designation of those virus impact as well, because the pie chart reflects over the past month. So it's been an active respiratory virus season.
Yeah, I'm going to go to Dr. Burch. Dr. Burch, the question is, with the knowledge that masks have prevented flu cases during the past 2 years, the question is, why is there not a larger push for more masking at a time when respiratory illnesses like flu and RSV are surging? But I know you talked about that being sort of something that you can do for yourself.
Yeah, it is. And, it's always something to think about. When you're ill, mask. If you're in large crowds, mask. It's very something simple to do. In the hospitals, I think the majority of us are masking just to make sure that we're protecting ourselves, but we're protecting others as well. So it's something that we can do to help each other. And I definitely think it's a good idea to put on that mask when you're going to be in big places, or definitely if you're feeling ill.
Good deal. Thank you. Are there any calls, do you know that whether we have received, you or Dr. LaCroix, any calls from other places seeking care for their children in the Upstate, in the Midlands, or the Midlands?
I'm going to let Dr. LaCroix answer that question.
Okay.
Yes, both Dr. Taylor, who is medical director of the Prisma Health in Columbia, and I talk many times a day. And we actually are both experiencing the same needs. I think it's been well publicized that children's hospitals are really being stressed with this. And we're having calls from North Carolina and Georgia, had a call from Eastern Tennessee. There is just a huge need for pediatric beds. And when we look at the growth of the pediatric population, particularly in the Southeast, our bed capacity has not expanded as quickly, because children, for the most part, are very healthy and don't require chronic hospitalization and frequent hospitalization. And that's one of the points about the bed counts, is that children thankfully get better quickly. And so once they begin to recover from some of these illnesses, and they're able to, they just heal so much better at home. And so we work to really get them home as quickly as possible.
Thank you. The question is this the classic circulation of RSV returning to normal, or is it really a sense of urgency? Is it like because we were out for 2 years and we didn't have it, is it really this just the regular, percentage, or is it really elevated?
So, when I look at the Midlands statistics, the Midlands had a tremendous surge of RSV, greater than that we had in the Upstate. I think one of the bigger pressures is really threefold. One is just, again, the growth of the communities. The second is the convergence of still a low level of circulation of COVID, somewhere less than 5%. But we layer on top of that fairly rapidly rising influenza cases and the RSV cases also being at where they might have been before. I think in the past, we've been able to temporarily space out these surges of infection, and they just happen to arrive at the same time.
Good, thank you. I think that is all of our questions. So I'm gonna go back to Dr. Gray for a minute. Dr. Gray, final thoughts on the season flu, being an emergency room physician, your final advice you would give to the community?
Yeah, so I would say try and be healthy, stay away from large groups. If you're sick, stay home, care for your family, and be careful. And if you can feel like you're sick and need care, I would try to urge you to see your primary care physicians and the urgent care. And then if you feel really ill to the point where you can't breathe, or feel so ill you can't get out of bed, then that's when you need to use the emergency department, and we'll be here for you.
Thank you. Dr. Burch, final thoughts.
So make sure that you are getting out and getting your flu shot. That's the most important thing to me. It's the best way that you could protect yourself from getting influenza or getting morbidity or mortality from influenza. It's easy. They're available. You need to be getting it now so you can get those antibodies being made in your body to really protect yourself.
Dr. LaCroix.
All right, thanks. So I'm going to come back to the things that carried us through the whole COVID pandemic. Good hand hygiene, alcohol-based hand sanitizer kills both influenza and RSV and COVID, and the other respiratory viruses as well. And just being sure that you are doing good hand hygiene, doing good cough etiquette. If you're going to be in large crowds, consider putting on a mask. It's not that people may be inconsiderate, but you are actually contagious with influenza a day before you're actually ill. So you can unknowingly expose your coworkers to influenza in a big group meeting as we're back to being together in conference rooms. Consider just throwing your mask on. It's pretty well accepted still today, and just continuing to monitor for the situation within the community. And if you haven't gotten your flu shot, go get it today.
Thank you. Thank you to our experts. I'm happy to be the person that gets to host these great meetings. We're our great experts, and we're here for you. We also have a blog called Flourish, and it's prismahealth.org/flourish, and it has lots of information, and it includes both information on all these topics and podcasts. So thank you for joining us again. If you have additional questions, those who are on Facebook, you can put them in the chat. For our media partners, please contact me, Tammy Epps, or Sandy D's, my tag team partner. Thank you. Everybody have a great day.